We're Group 7, and we have created a presentation that we think would be useful for educating students in programs for primary care professions, such as medical schools, PA schools, and nurse practitioner schools. This presentation will explain to them what PT is and how it can help in prevention of opioid use disorder, and will also give them some ways they can help.
Today we are here to talk to you about physical therapy's role in solving the U.S.'s opioid epidemic. Many Americans are prescribed opioids for treatment of their pain, and their use of opioids often progresses to misuse, which leads to several negative physical and social outcomes. Opioids are commonly prescribed for chronic pain in particular. An article from the Annals of Internal Medicine reports that in 2015, chronic pain affected an estimated 100 million Americans. That's 1/3 of our population. That number has only grown since then. Also, in 2015, another study from the Annals of Internal Medicine reported that of the estimated 91.8 million U.S. adults over the age of 18 who have used prescription opioids in the last 12 months, 11.5 million of them had misused them, and 1.9 million had an opioid use disorder. According to that data, it's pretty clear that the way we currently treat pain in this country isn't the best. So, what is a different approach that we can take for treating pain in the U.S.? Because of the evidence supporting it, we believe that PT can be a big part of the solution to this problem.
Before we get into what we think we can do for reducing opioid use, we would like to clear up any confusion there may be about what a physical therapist does, because not everyone out there really knows. Our vision statement is transforming society by optimizing movement to improve the human experience. This simply means that we treat the musculoskeletal system to improve quality of life in all areas, including pain, function, and social participation. Unless you've had PT yourself, it is hard to understand what exactly we do. And even then, you probably still haven't experienced the full scope of things that we are capable of. In fact, some of us did not even fully understand the profession before we began our training. I personally had no idea that physical therapists could be involved in things like cardiopulmonary care and pelvic health.
Now that we have established what the physical therapy profession is all about, what is it that PTs can do that will help prevent long-term pain leading to opioid addiction? Instead of treating chronic pain primarily with opioids, the CDC now recommends using non-pharmacological treatments as the first line of defense for chronic pain. The literature shows that this approach works better than opioids for pain. A study by Davis and Mehta found that using non-opioid therapies resulted in a 4 times greater likelihood of recovery from chronic pain compared to using opioid therapy. Physical therapy is considered one of these non-pharmacological therapies for pain, and therapists are armed with several effective methods for reducing pain without medication. These include dry needling, therapeutic exercise, and manual techniques, all of which have shown positive outcomes in the literature.
Because of this evidence, we feel that we should be at the front lines of treating pain in the U.S. alongside all of you. A 2012 study concluded that early physical therapy following a new primary care consultation was associated with reduced risk of subsequent health care compared with delayed physical therapy. This means that patients who got treatment from a PT early in their episode of care needed less follow-up care than those who did not. Despite our push to be on the front lines of treating these patients, there is one important thing to remember. We absolutely do not want to detract from your role in treating pain, as pharmacological methods are typically necessary in reducing pain enough so that movement can be done, especially initially. What we do want to do is work with you to reduce the number of patients you are seeing with chronic pain so that you can focus on all those other patients who need your life-saving expertise. So, what can you do to help us? First, you can encourage your future patients to truly give PT a shot as the first line of treatment for their pain by not only referring them to us, but by putting in a good word for us. We know that we can help your patients, but they need to believe it too. A study from 2010 concluded that expectation may serve as a significant prognostic indicator for individuals with musculoskeletal pain conditions when being treated with physical therapy. This means that if they expect to do well in PT, they were more likely to have good outcomes in PT. Your patients will really trust you, so your word is the best endorsement we can get. Second, you can advocate for us being able to see these patients first through having direct access, with the understanding that we are not trying to compete with you, but instead we are trying to work with you. Being there in those first few encounters is critical for us in educating these patients on their pain. An article from the Journal of Orthopedic and Sports Physical Therapy emphasizes that educating patients on their pain can increase their self-efficacy and will lead to less reliance on the healthcare system over time. In this way, physical therapists can help with both primary prevention before the patient is ever prescribed an opioid and with secondary prevention by encouraging self-management of pain, therefore reducing the likelihood of the patient progressing to opioid misuse once they have already been prescribed opioids for pain.